My name's Alison Moon. I'm one of the independent non-executive members of the Integrated Care Board, and I have the pleasure of chairing the board today. We had a really interesting agenda, lots of hugely helpful contributions from colleagues around the table, and there are three main areas I'd like to pull out. One is from the Chief Executive report, where we noted that there is an emerging risk around GPs rejecting the national contract that's on offer and the potential for industrial action. We're not clear what that means in detail yet, and there's still some way to go, but we did note it as an emerging risk, and as you will know, we've had a lot of industrial action across the NHS over the last few months, so we are preparing for the worst of having that, but we just wanted to note that as a risk today. The two substantive items were really interesting and very important to us as an ICB. The first one was the local maternity and neonatal system reporting on the work across the system in maternity services and neonatal services. These systems and services are under huge scrutiny nationally, and there's been an awful lot of sad cases across the country of where people have received very poor care in maternity services. We were really delighted to hear today that both of our trusts, UHBW and NBT, have had the Care Quality Commission inspections since the last time we met, and they've both been rated good for their maternity services, and that bucks the trend, and we heard today that 75% of maternity units that have been inspected have been downgraded, so this is great news to give confidence to the people in the services and those people who are going to be using them. That said, it's a strong foundation to build on, but we also heard about areas that the professionals want to work on, and that's particularly around health outcomes for people from a black and minority ethnic background who we know in maternity services nationally don't fare as well. So the board was very supportive of very specific pieces of work and being part of a national pilot on how you can improve maternity care for people from a black and minority ethnic background. We also asked Rosie Shepherd, who's the chief nurse who presented the report, for a focus on people where English isn't the first language, as we also know that's a big issue in our system. But generally good news for our system, but more work to do and certainly no complacency. The second item was an agenda item called NHS Impact, and this is the ICB approach to a national initiative from NHS England on how improvements can be done in a more structured, systematic and therefore more designed to be successful outcome. Debs Al-Sayed, the Director of Transformation, led a really good presentation and discussion about how lots of improvement methodologies are happening across, so how can we improve services, and one of the colleagues around the table said this is really about how we get people to have better care, faster care with less waiting, and that's where if we come together as the sum of the parts, which includes our local authority partners, all of our NHS partners and the voluntary sector, we've got a much better chance of improving services. So the board fully supported the proposal to have a mandate to have a system-wide approach to how we improve services. So watch this space on both of those items, but some really good foundation work designed purely to help improve the care for our population.